when I fell in love with nursing, it was when I started doing home health nursing. When I started working in home care nursing, the impact of community or lack of community and resources on folks is what caused me to push a little bit more to getting students, especially, to understand what health equity was. Culturally responsive care need to be threaded through each and every course. It needs to be part of the culture. It needs to be part of the fabric and the weaving of what we are creating. And so for me, I think the intentionality is using our professional organizations to guide how we are teaching this stuff. You hear nurses all the time, I'm not trying to get involved in politics. Well, baby, if you're not involved in politics, right? If you're not involved in policy, then you're not involved in care of people. And as nurses, we're about caring for people. So we have to understand and we have to be mindful of policies. History of media, nurses were set to look a certain way, to act a certain way, to do a certain way. And we have to be the ones that are changing that in order for people to not see nurses just as bedside. And that's fine if they are.
Yeah.
But nurses are in the boardrooms. Nurses are not just in healthcare. We're involved in other areas that impact health. As nurses, we can't do everything, and realizing we can't do everything. Finding that one thing you're passionate about, whether it's mental health, whether it's disabilities, whether it is racial inequities, whatever it may be, find that and going hard with that one thing.
Welcome to the Nurse on Purpose podcast, where we challenge media stereotypes about nursing and spotlight the incredible and diverse roles nurses play in healthcare. I'm your host, Nello. Every week, I'll be joined by a nurse who is reshaping the narrative. From frontline care to leadership, education, innovation, and beyond. Our aim is to show the world that nursing is so much more than what we see on TV. Together, we'll explore how we can collaborate with media and other stakeholders to create authentic and inspiring portrayals of nurses. Let's begin the conversation and ignite change, one episode at a time. Hi guys, welcome back to the Nurse on Purpose podcast. Today's guest is someone who doesn't just talk about health equity, she walks it, advocates for it, teaches it, and literally brings it to your doorstep. Dr. Yvette Conyers is a nurse practitioner, educator, wound and foot care specialist, and a fierce advocate for justice in healthcare. She's the founder of Foot and Nail Health LLC, a mobile foot care service for individuals who are homebound, who have limited mobility, or are managing chronic illnesses like diabetes. With over 20 years in healthcare, Dr. Conyers has built a career around preventing disparities, including amputation disparities in underserved communities, and shaping the next generation of nurses to lead with equity, compassion, and cultural humility. You're welcome to the podcast, Dr. Yvette Conyers.
Thank you. So happy to be with you. Thank you for the invite and looking forward to chatting with y'all today.
Yeah, I'm looking forward to it. It's such a pleasure to have you. We met I think we've kind of bumped into each other in different settings.
Yeah.
But we officially got introduced at the conference that took place in Maryland recently, a couple of months ago. And I just noticed that even with being in the State House, you're just so involved in so many things, especially around the topic of equity, right? Mm-hmm. And so today I want to explore your unique path, the impact of mentorship and what it means to create care that truly meets people where they are, both physically and culturally, which is at the heart of your mission. So let's talk about that, right? What is it that drew you to this work of health equity? What gaps did you feel like you wanted to fill in nursing and in healthcare in general? And where does that stem from for you?
Yeah. So I would say for me, this started when I was working in home care. Didn't realize really what home care, part of community health nursing was. And I was working at a home care agency through an agency and wound up going on full time with the agency. But that's when I really saw, back then it didn't have a name to it, or at least I was unaware of it. But that's when I really saw what the social determinants of health were, even political determinants of health. And so my exposure by going into people's homes, realizing that the control I had in the hospital, giving them their medications, all these things where I had a little bit more power was not as present as it was with me going into people's homes and really realizing my vulnerability for them to even open the door for me, right? It goes back to
Mm,
building trust into these communities or communities that we work with. That trust is so important.
mm.
And that's when I really started to see the impact of everything else: housing,
Yeah,
food access,
yeah,
transportation,
yeah,
insurance coverage,
yeah,
right? On someone's health.
yeah.
And that's when I was like, oh, I actually like this. This is
Mm,
where, Yvette, you should be. You
mm,
should be at the point of trying to navigate these barriers or trying to prevent things that happen. So then you're not seeing them on the other side, which is that hospital side. And that's
mm,
when my eyes grew big and I had that aha moment like, this is
mm,
it. And so I have a saying of when I fell in love with nursing, it was
mm.
when I started doing home health nursing.
Wow, that's so important. Can you tell us like one moment, maybe a story with a patient experience that you had where a social determinant of health, because we hear that term used a lot.
We
Like,
do. Yeah.
yeah, can you give us an
Yeah.
instance where that you saw that really come to life in your practice
I
as an
surely can. It's very vivid. I was doing a home visit. I was doing an opening, which was a person who was new to home care, and I had to go and
Mhm,
conduct the assessment and interview for that.
mhm,
And this was a lady who lived in the city. I walked into her home, limited English speaking, so I had to
mhm,
use the phone for an interpreter, right?
mhm,
Language
mhm,
access
mhm,
services is a
mhm,
example of a social determinant that can impact care. And when I went into her home and sat down with her, she started to tell me about her son who lives there and who was caught up in sort of the criminal justice system. And she
mhm,
had diabetes. And so we went to her fridge and I opened up her fridge and she had nothing,
mhm,
like nothing. Opened up the refrigerator, a few bugs, roaches, right? Which the quality of the home environment is also a social determinant, which can lead to health
mhm,
issues like asthma and other
mhm,
respiratory problems, COVID, um,
mhm.
uh, worsening symptoms of COVID. So she
Yeah.
had nothing. And knowing that she had diabetes, for me, my concern was her blood sugar, right?
Mm,
And at that time, I checked it and I wound up getting so emotional because she was saying
mm,
she did not have food because she was caring for the loved one who, again, was in and out of the criminal justice system. So I wound up calling my supervisor when I got into the car and shed a tear. And I was
mm,
emotionally distraught about what I had saw, but
mm,
also how I felt powerless because
mm.
at the end of the day, it was referred or APS, which is Adult Protective Services. And that's when I realized the influence of policies, right? And the policies that are created to help people and or harm people as well.
Mm.
So yeah, it was social determinants with the lack of food, the quality of housing that she was in, but it was also the political determinants in what I was able to do or not do for her based on what she had.
How can we bring this culturally responsive care or culturally responsive like nursing education to every classroom and every clinical setting so that people truly understand that
Yeah.
cultural responsive care is not limited to what you learn in a certain course, but
Yeah.
it's critical and it really affects every aspect of our lives.
hmm I'm so happy you said that, Nello, because I am an educator. I have been an
Mhm,
educator for about 15 years now, started at different institutions and from a clinical instructor to now as an associate dean. And I
mhm,
truly do believe that one class is not going to teach what is necessary. It truly has to be topics around health equity and
mhm,
culturally responsive care need to be threaded through each and every course. It needs to be part of the culture. It needs to be part of the fabric and the weaving of
yeah,
what we are creating.
yeah,
And so for me, I think the intentionality is using our professional organizations to guide how we are teaching this stuff. Our
mhm,
ANA Code of Ethics, our AACN Essentials, American Association Colleges of Nursing Essentials, mission and vision of our institution, our values of our institutions. These
mhm,
are the things that when you really break those down, words like health equity and inclusion and belonging and community and responsiveness are all in there, right? And so it's important for students to realize this ain't me walking into the classroom thinking things up.
mm,
This is rooted in our
right,
profession of nursing, which has been around hundreds of years.
yeah.
Um, right. So I think that's part of it is understanding and connecting it back to this isn't Dr. Conyers as an expert in this topic coming to talk to you, but these are things we are pulling from the profession that we
Yeah.
are hoping to role model for you. And
Yeah.
then that becomes apparent, and you're able to then put that into the patient care you're delivering.
Absolutely. I want to talk more about your practice or your business, right? What inspired you to start Foot and Nail Health?
Yeah.
Why did you focus on that
Mhm.
specifically in underserved communities? And how does that align with your larger mission in healthcare?
Yeah. So for probably almost 20 years, I've been doing home health, right, or some form of it. Even when I went back and got my advanced practice nursing degree and working as a
Mhm.
nurse practitioner, I was doing home visits for insurance companies and annual
Mhm.
wellness visits. And
Yeah.
part of that, my physical exam, was removing their shoes and socks to assess
Mhm.
their sensation and
Mhm.
to look at other things. Well, many of them who had diabetes or who had limited vision or who had limited mobility or who were obese, I found that their feet and nails were being neglected. Their
Yes.
toenails were really long. Their
Mhm.
toenails were really thick. They had
Mhm.
rashes and other fungal infections going
Right.
on. And so I said to myself, well, if I see that this is a need, right, and it's the first thing to sort of get neglected once other
Mhm.
things begin to transition, how can I fill in the gap? And
Mhm.
as nurses, as advanced practice nurses, and now as a DMP, that's what we do. We fill in the gap,
Mhm.
right? We look at the evidence and fill in the gap. And so that's what led me to create Foot and Nail Health, which has been around for about 3 years now, started in New York State and now here in Maryland, where I am. And the other thing was going back to social determinants of health access,
Yeah.
right? I didn't want people to come to me. I wanted to be a provider where I come to them, because that's
Mhm.
also something I was hearing about the need to
Transportation.
get to these
Mhm.
places is being a burden. And so, yes, I do go to these, my clients, most of them do reside in city areas or low income areas, but I will serve anyone within sort of a radius. And it really is providing routine foot care for them and filling in a gap where podiatry are not able to, because at the end of the day, podiatrists are also surgeons. They can
Yeah.
practice and do other things. And as a nurse and nurse practitioner, providing routine foot care really focused on prevention and trying to prevent amputations and preventing complications from things like diabetes, peripheral vascular disease, and a lot of education, which nurses
Mhm.
are great at providing health literate education.
That is so wonderful that you took a burden and a need and you turned it into sort of a mission and a purpose. And it lines up with providing filling in those gaps where you see health inequity and social determinants of health that are affecting patients every day and really going into that direction. Some people would say, "Ugh, I don't want to touch anyone's
Yeah,
feet."
yeah, I hear that all the time. Like, you touch your feet, it's
And
not about that.
I hear you because those feet are neglected. I did work
Yeah.
in home care as well, and sometimes they have loss of sensation and don't even know it,
Mm-hmm.
because you don't
Mm-hmm.
know what you don't know, and they don't realize that the fact that they're losing sensation
Yeah.
is, is a red flag and
Mm-hmm.
something needs to be done about it. They're like, yeah, I don't really feel, but I feel a little bit, and
Right, right. And then
next
then they develop, a
vascular
diabetic foot ulcer,
issues.
which leads
Yep,
to a wound and
that's right.
osteomyelitis, and now you're trickling
Right.
towards that amputation. So yeah, I'm trying to
Absolutely.
work on upstream, that
Yeah.
preventative side. Let's start up
Right.
here before we get down here and lose a toe, then a foot, then up to a knee.
Yeah, that's right. Okay, so you mentioned being the associate dean of EDI. Can you talk about that? And specifically, what are some of the biggest challenges that you see in advancing diversity in nursing?
Yeah, so this associate dean role is a senior leadership position, and most of it is function at, providing the school staff, faculty, and students with the support that they need in order to address health equity, right? Again,
Mm,
if I connect that back to the mission and the vision and the core values in our nursing profession, no one's doing anything, I'll say, illegally, right?
mm,
The work is important because at the end
mhm,
of the day, patients need care, and patients
mhm.
need the care that they need in
Right.
order to be successful, in order to have the health outcomes that is best for them. And that is what my work is all about, is ensuring that those who I work with. And then
Mm,
again, that trickle impact is the patients, that
yeah.
as I am preparing students, that they have the tools necessary to understand how to assess a
Mm,
patient, a community, a population, in order
mm,
to determine what is it that they need, and that they have tools in their toolkit or tool bag in order to then
mhm.
implement it. And if
Right.
they don't know, then we are talking about resources. We are talking about interprofessional collaboration, social work, PT,
Mm,
physicians, right?
right.
Healthcare is a team sport. we're not going to get it done alone. And so I think for me, again, it's connecting it back to health equity work, inclusion work is about connecting it back to the profession. But while we're doing that, creating a sense of community here where people feel like they belong here at this institution. They feel
Yeah.
like they can thrive. They feel like they have the best for them to succeed here as a
Mm.
faculty member, as staff, and definitely as a student.
Have you encountered any instances in your journey from as a nurse and now, well, let's start from student,
Yeah.
from as a nursing student, as a nurse, and now in leadership and doing this work of equity, diversity, and inclusion? Do you have any personal stories that really drive this passion, like your why you do this work, why it's important to you?
Yeah, I think at the end of the day, it goes back to some of my identities, right? I identify as a Black woman. I was a teen parent, and having those identities in which people react to maybe cause you or have caused me to sort of work a little bit harder, to go a little bit harder, to not be a statistic as a teen mom getting pregnant at 17 and, oh, she this and she gonna be this, right? So some of that came internally for me to push forward. But then
Mhm.
also, as I mentioned earlier, really seeing when I started working in home care nursing, the
Mm.
impact of community or
Mhm.
lack of community and resources on folks is what caused me to push a little bit more to getting students, especially, to understand what health equity was. And
Yeah.
I think another part of that is that one of my faculty members, Marilyn Dollinger, was big on policy. And she
Mhm.
exposed me to policy in my master's program and then obviously in my doctorate program. We're understanding how policy has such an impact on what we do. And you hear nurses all the time, I'm not trying to get involved in politics. Well, baby, if you're not involved in politics, right? If you're not
Mhm.
involved in policy, then you're not involved in care of people. And
Right.
as nurses, we're about caring for people. So we have to understand and we have to be mindful of policies.
We are involved in it one way or another,
We sure
right?
are. It touches all of us.
Either the policy is being made without us at the table and we
Right.
have to adhere to it, but one way or another, it involves us, it impacts us.
Mm-hmm. Mm-hmm.
So why
Mm-hmm.
not get involved and make those decisions on our own behalf?
Yeah. And I think too, sorry not to cut you off,
Yeah.
but I think
Yeah.
too, like, people think, oh, well, I'm not trying to be no senator or no president. Like, policy starts local. At the
Mm-hmm.
end of the day, policy starts local. Do you know who your district officials are and
Yeah.
representatives are?
Yeah.
Do you know who your mayor is? Do you know who your city council person is? Your school board? It starts local, right? It's sometimes it seems that it may be so abstract, so intangible for people to access
Yeah.
and to understand, but it starts local,
Yeah.
and
Yeah.
that's what I try to tell my students too.
Use your voice wherever you find yourself. Like you
Yeah,
said, it starts local. It starts very local. For me, I consider this podcast as a form of speaking up, of
yeah.
advocacy, of showing the truth about nursing, right?
Mm-hmm.
So it doesn't always have to be like a march, at the state house or
Mm-hmm.
whatever
Mm-hmm.
this big picture that you've painted in your mind, that policy or advocacy is. And it could be that
Could
very
be,
much
yeah, for
so,
sure.
for sure, because that's a big part of it. But it really is about using your voice and speaking up, and whatever that whisper in your heart is, use that, tool, because if we stay silent, no one is going to speak on our behalf. Like, nobody cares about you that much. Everyone is working for their own profession and for their own good. So if you
Mm-hmm.
don't use your voice will never be heard.
Yeah.
But speaking about advocacy, when we talked a little bit during that conference, you mentioned the importance of nurses being more visible, right, in mainstream media, beyond social media. And also, I think you talked about applying for the George Washington Advocacy and Media Training.
Mhm.
Why do you think nurses are often left out of these conversations? And how can we position ourselves as expert voices in
Yeah.
healthcare, whether it's news, whether it's policy discussions? How can we get involved?
Hmm. It's interesting. I'm reading this book called Taking Care by Sarah DeGregorio, and
Mhm.
she is not a nurse, but as an author, she is talking about the story of nursing. And
Mm.
that question just reminds me that historically, as nurses, we have always looked to someone else to give us
Mm.
direction and guidance for the
Mm.
most part. Some of us were very innovative in doing things ourselves without that, but many times we have referred to physicians, right? And so I think it goes back to systems and structures that have been put into place for us as nurses to always look at someone else for approval.
Mm,
We as a profession are over 4 million strong, close to
mm,
5 million strong. And I think it's important that we realize that voice of over
mm,
close to 5 million is so strong and that we don't
mm,
need permission. And this
mm,
is how I think we got caught up in advanced practice roles and sort of, we not good enough and yes, we are, and all this sort of back and forth. And at the end of the
mm,
day, patients and patient care and community care and population care and global health care is what we should be doing. So I think it's about recognizing our power as individual nurses, as you mentioned, and
mm.
collectively. And our voice and our impact can be so much greater if we really do coalition building, if
Yeah.
we really come together to just raise our voice. And so I do think it's important. I also think in history of media, nurses were set to look a certain way, to act a
Mm,
certain way, to do a
yeah.
certain way. And we have to
Yeah.
be the ones that are changing that in
Yeah.
order for people to not see nurses just as bedside. And that's fine if
Mm,
they are.
yeah.
But nurses are in the boardrooms.
Yeah.
Nurses are not just in healthcare. We're involved in other areas that impact health,
Health. Yeah.
right? We
Mhm.
are involved in so much, and it's about nurses understanding that individually and then collectively, let's come together to really look at the impact that we can have.
Yeah, for sure. Now, in this climate that we live in, there's so much going on, so many changes with, with the turn of a new era, of a new kind of
Yeah. Yeah.
new house rules, right?
Yeah. Yeah.
Whether it's Medicare cuts, whether it is immigration policy and ICE and tariffs and
Mhm.
all of the economic instability that we are seeing these days. How can nurses, nurse practitioners become advocates for some of our marginalized patients, right? While we're kind of trying to navigate any policy induced fear, inflation is on the rise, tariff threats and all of this stuff is going on. And we know that when the cost of living rises, right, then we're looking at economic strain,
Yeah.
which then leads to healthcare avoidance. So how do these financial barriers intersect with health inequities?
Mhm.
All the ones that we're seeing on the ground, particularly in these low income communities.
Yeah. I think very much so. Just as we talked earlier and started about social determinants of health, finances, right, and
Mhm,
income,
mhm,
and having that financial mobility
mhm.
is also part of how one gets access to health, right?
Yeah.
The good insurance versus the state insurance, or private insurance versus, I ain't gonna say good, but private, versus state insurance. I think it's important for us to understand too that as a nursing profession, as we are dealing with ensuring that people have access, we are feeling the impacts of this too as individuals and maybe for our families,
Yeah.
right? And so I think we have to sometimes pause and reflect on how are we feeling and how are we showing up for ourselves
Mm,
before we can then continue to talk about how are we showing up for others. Because if
mm,
our cup isn't filled, we are pouring from nothing. And so I
right.
think that is important right now as we're going through sort of these administrative changes and these impacts on us to
Mm,
pause and pay attention to our bodies,
yeah.
especially our folks who have been doing this work for a long time. We want freedom, we want liberation, we want justice. That takes a toll on bodies, especially Black bodies. And we have to
Mm,
understand that,
yeah.
especially as healthcare professionals,
Yeah.
as we are doing this work. And when your body says pause, rest, you gotta listen to your body. I'm
Mm,
reading a book now by Trisha Hersey called Rest is Resistance.
mm,
And it's a nap, it's part of the nap ministry, which is her work on resting, daydreaming, reimagining,
mm,
liberation, and freedom. And I've been reading that for the past 3 weeks on audio, and it is
mm,
truly changing my heart and my mind and my perspective about the importance of rest and the history of the struggles in our bodies to do. So, yes, while it is important for nurses to be doing this advocacy work, and looking and taking care of the most vulnerable, because that is what we are obliged to do in our code of ethics. Also realizing the impact this is having on us physically and emotionally and mentally and spiritually, and
yeah.
pausing to do check-ins to see how we're feeling individually and then collectively.
That's wonderful. I want to end on a couple of notes talking about your role in mentoring and leadership. I know that you're passionate about mentoring, and networking.
Hmm.
Why do you believe that these are so vital to
Yeah.
professional and personal growth in nursing? And how do you mentor students or, let's say, early career nurses who
Hmm.
maybe have their eyes on leadership but may not see themselves represented?
Yeah. And I think that's it. I'm going to start with what you just said, that representation matters.
Mm,
One of the big supporters I am of is DMP's of Color and Danielle McCamey and her work with mentoring. And it's
mm,
about seeing it to believe it, right? And it's about creating a space for others to feel safe, to
mm,
feel brave, to feel heard, to be authentic, to be vulnerable. And those
mm,
spaces matter. And I
mm,
also think that mentoring piece is part of role modeling. So I see somebody, and I'm like, wow, that's the only black professor I done had in X, Y, and Z years. And
mm,
wow, I actually am interested in wound care too. And I think
mm,
naturally in the classroom, when I'm able to be me, people see that. People
mm,
respect that. People
mm,
are like asking, how is she showing up?
mm,
Right? That humanity is important in mentoring. And so I think for me, it comes with students seeing me just for me. I ain't
mm,
sharing all my business, but I am
mm,
letting you know I'm human at the end of the
mm,
day. I have my struggles. And then I think mentoring for me has just sort of happened in terms of how students are accessing me, or I'm saying to them, do you have a mentor?
mm,
Would you be open to a relationship, because it is a two-way street, on a
mm,
mentoring process? And we set it up from there. And I
mm,
have numerous mentees where we meet sometimes every month, and sometimes we don't talk for 2 or 3 months.
mm,
I, as well, would not be where I am without mentors and sponsors and coaches. Those are three separate things that I always talk about. A mentor,
mm,
again, is that two-way street, right?
mhm,
There's some give and pull. A sponsor is someone who's speaking your name in rooms that you're not even aware of, which is how I'm
mm,
in my current position. Someone
mhm,
put my name up, and yeah, I
mm,
had to do the work and apply and all that.
mm,
And then the coach is really there to listen.
mm.
They're taking what you are saying and they are having you examine, but it's all based on what you're saying,
Yeah,
right? And they're having you examine. And when you want to get to that next step in life, that coach is there to cheer you on, to
right.
push you, but you got to do the work. So
Yeah.
a mentor, a coach, and a sponsor is what I think everyone needs to have in their life at some point in time.
You're a firebrand. You know that?
Oh, thank you. No,
Did
thank
anyone
you.
ever call you like small but mighty?
Yes, I have heard that. Yeah.
I think that was my experience with you. My very first thought was like, "Oh, she is small but mighty."
Oh, thank
We had
you.
spoken at the what was it? The ANA, the
Yeah, the
Maryland.
ANA, the Health Equity Summit
Yeah,
they
yeah.
had this year.
And I was like, she don't smile at anybody.
Yes, that face just like, I'll be trying to smile, I'll be smiling on the inside. I'll be
I love that. But your heart is just gold, and I'm grateful that I have you on the show. One last question.
yeah.
What do you think is one small action? We talked about advocacy being local. What is one small action that any nurse can take today
Mhm.
to start advancing equity in their own sphere of influence?
Yeah, you said something about this earlier. It's about finding something you're passionate about and going hard with it. As
Yes.
nurses, we can't do everything, and realizing we can't do everything, but finding that one thing you're passionate about, right? Whether it's trans rights, whether it's mental health, whether it's disabilities, whether it is racial inequities, whatever
Mm,
it may be, finding that and going hard with that one thing.
awesome.
Yeah.
Okay, we're going to switch it up and have some fun
All
now.
right.
So we already kind of talked about this a little bit, but can you just shed some light? What are your thoughts about how nurses are portrayed in the media and what can we do about it?
Yeah, I think we've seen some changes, especially
Mhm,
post COVID. We've
mhm,
seen some changes in terms of the respect of the
mhm,
nurses and the true
mhm,
value that they bring to a team. I don't know if COVID had to happen for us to see that, and maybe it did. I'm sort of glad that we are being seen as leaders, as
mhm,
innovators, as people who can be the front runners for things related to all things healthcare and health.
mhm.
And so I think that's the main thing that sort of stands out, is understanding that nurses, we have come a long way in media.
Yeah.
We still have a long way to go, and thankful for
Mhm,
podcasts such as yours that are shining light on nurses and what we can bring. But I think it's, again, important for us to get out of that attending only nursing conferences or only healthcare stuff and entering spaces of technology, entering space of business, entering space of entrepreneurship, because nurses can be at all tables. And so in media, beginning to diversify where we're at and what table we're at.
That's wonderful. All right, let's play our game. I'm going to shake the jar around. And
Okay.
you, Dr. Conyers, will turn into a screenwriter, right? And come up with
Okay.
your own show because we're talking about problems or we're talking about solutions as
That's
well.
right. That's
If
right.
you could create your own show featuring a nurse character, what would that show look like? It could be a book, it could be whatever. Depends on what I pick out of this jar. Are you
Okay.
ready?
Yeah, I'm ready.
Yeah, let's go for it.
All right. Drum roll.
Ooh, I'm so excited for this. I don't know why. Wow, okay. So your category is medical series.
Medical series. So I'm a character on this show.
Well,
I'm the screenwriter.
yes, you're the screenwriter. You're creating a character. And she's a nurse or he's a nurse.
All right. I'm going to say medical series. The character will be a student nurse. I don't feel like in the medical series or shows I have seen that there has been emphasis on student nurses, residents.
Yeah, a lot of
Yeah.
residents and even medical students, but
Yeah,
never
medical students. Yeah, medical students, residents, but student nurse. And them sort of acclimating and getting exposed to the culture of ED, labor and delivery, whatever unit you want to say. But I'm going to say I would like to create a student nurse character and to show how that evolution and how that mentoring or lack of mentoring or coaching or sponsoring really develops a person into a person.
I love it. That was wonderful. And we'll see her whether she's being hazed or
Yeah.
kind of,
What's going on? Microaggressions going on, right?
Yeah.
Which they're not micro at all; they're macro, right? Is it a student who is, navigating a disability that they have, right? And how they are being supported in that clinical environment with that disability, right? Whether it's physical or whether it is, mental, whatever it may be, is the institution creating a space for that person to thrive, for that person to feel belong, for that person to go up the leadership ladder.
That's wonderful.
I would say a student nurse.
I love it. Thank you so much.
You're welcome.
If you could recommend a guest to be on the show, who would it be?
I'm not sure who all you have had, to be honest.
But I'm about to have Danielle, so you can.
Okay. That's my girl. That's my girl. Hey, Doc. I'm gonna say fierce Dr. Celia McIntosh.
I'm gonna write that name
McIntosh, advocacy. She is a human trafficking justice warrior. She is Black maternal health. She is workplace violence and civility, and how we should be creating spaces as Black people and feeling good about what we do. So Dr. Celia McIntosh, that's my girl from upstate New York, and a proud member of we were both previous members of the Rochester Black Nurse Association. So shout out to Black Nurse Association.
And where can people find you to connect with you?
For me, best to find me on LinkedIn. So Yvette Conyers, will make sure we have that. But if you want to check me out on my website, footandnailhealth.com, you can see the stuff that I do. If you have folks in the Baltimore, Maryland area who are in need of routine foot care, have them reach out to me too. So again, we can really focus on our missions of protection, one soul at a time.
Awesome. Thank you so much again for being a guest on my show. Guys, thank you for tuning in. Dr. Yvette Conyers here. If you were inspired by today's episode, don't just keep it to yourself. Please share it with a colleague. Tag us on social, leave a review, and be sure to check out Foot and Nail Health LLC to learn more about her work in action. Until next time, take care. Bye-bye.
Bye. Thank you.
Thanks for hanging with me till the end. I hope you gained some valuable insight into the world of nursing. If today's episode inspired you, please like, subscribe, and share with someone who needs to hear about the amazing work nurses are doing. Let's keep breaking stereotypes and reshaping the narrative together. I'll see you next time.